It's a year since the first positive case of the coronavirus was identified in the country. Since then, over 1.5 million people have contracted the virus and more than 50,000 have died. It's had an impact on how we live, work, learn and play, and importantly, on our economy. Number of our reporters are up and about in different parts of the country this morning. We've got Heidi Jokos here in Johannesburg, outside the Charlotte Maxeke Hospital. We've got Mawande Keswa in Durban, and we have Ayesha Ismail in Cape Town. Good morning, Ayesha, Heidi and Mawande. But first up, let's start in the mother city with you, Ayesha Ismail. I understand you've got an MEC there for health as our guest this morning, as we reflect back on 1 year on living with the coronavirus.
That is indeed so, Bradan. And while the Western Cape is in the process of exiting the second wave, health authorities are saying that they're already preparing for the third wave. But I'm now joined by the MEC for Health here in the Western Cape, Dr. Noma French Mbombo. At the Digicon early in the week, we heard about the fact that the numbers have decreased significantly, as well as hospitalizations and deaths. But we are already preparing for a third wave.
Yes, indeed, because the second wave caught us off guard because of the variant, which it was picked up towards the end of October by the researchers. So now with the third wave, we want to make sure that we are very prepared. But noting that when we had the first wave, we were sort of overly prepared in the sense that we prepared for the worst scenario. I got reminded now when I was looking in terms of the number of deaths that we have, which is about 11,250. If you recall, when we were preparing for the first wave for the worst scenario, we thought that we will have the 11,000 deaths actually by June in regard to the preparation for the first wave. And also, if you recall, in the first wave, even the number of the quarantine sites where we look for example, for many of the hotels, which were also assisted by the National Public Works to identify, which we ended up not utilizing. I think probably people were off guard when we had the second wave, and also were so much relaxed, and it was also coming to December, and then that's when now the second wave hit us hardest. So that's why for the third wave, we must make sure that we are prepared. And also the other thing about the second wave, it was when we were coming down from the first wave, we allow some of the non-COVID cases to come to the hospitals, and also did some of the minor operations. Now we are learning that we should be able to prioritize which non-COVID cases. For example, the issue of the mental health is one of the challenges across. So we might not necessarily be able to do as many things, especially under the budget constraints. So that's why we are prepared. But what is also crucial is to make use of the existing information that we already have, because already in terms of the surveillance that we have already seen, where we'll find that from the testing of the water, like in the city of Cape Town, one could be able to pick up some of the strains of the viruses. So even if we haven't tested people in a particular area, but based on the sewage and water testing, you can see. And also based on using the antenatal care for those people who take blood for antenatal care, when the researchers now try to find out if is there any antibodies there. Already we knew that in Khayelitsha and other areas, people already have been infected, although they might not have necessarily been tested based on the antibody test. Recently, we saw with the results from the blood donors, although it wasn't in the Western Cape, but in the Eastern Cape and KZN, for example, where they saw that there are many in the areas across racial groups where they've picked up antibodies. So with that information, it will make us to be able to plan accordingly, according to those areas, so that we can just come in and do whatever that needs to be done, especially for those people who have got comorbidities and who are the older persons, so that you don't wait for the people to be tested in order to confirm for that. So it will make us to prepare as early as possible, especially in regard to the beds.
Now, the experts are saying that it's highly unlikely that we're going to be reaching our herd immunity deadline, and therefore the Western Cape is already preparing for a third wave. What I need to ask you, though, there was a lot of talk about the fact that during the first wave, there was this, Khayelitsha had a very, very high number of infections, hospitalizations, and even deaths. With the second wave, that number wasn't as high. Is there a possibility that Khayelitsha may have achieved some form of herd immunity?
Yes, one may argue about that. However, what we know is about, for people who have been infected, there might be a possibility of the reinfection, probably by a variant or by another variant that may come up, because there's a whole issue of the evolution of the variants. So we don't want to create that hope where we say that we have been infected, now it's okay. Because with the international, some of the studies, international studies, they do show that actually in terms of the immunity, it might last for 3 months, or it might last for even longer. Nobody knows. So that's why we don't want people just to relax. They must always be on the alert. But indeed, it does show that for the second wave, it didn't hit them hardest. But we don't know whether probably, now that probably in the first wave there was no variant. And then what if it so happened that when you have been infected with no variant, and then you ended up having a variant. So that's one of the issues where you'll find that, like now, Khayelitsha is one of the sites for the vaccinations, for the healthcare workers, so that we can protect them. Because we don't want a situation where, as we have seen in the previous waves, you have to close some of the beds, especially when the staff, most of them are in quarantine and isolation, and also some of them will find that they are also affected for the whole, we have seen in some of the facilities, like in the clinics. At least now that we will be able probably to vaccinate almost 40% of our staff from these J&J vaccines. It will mean that at least the health system won't crack.
Now, speaking about vaccinations and the vaccines, how many healthcare workers have been vaccinated so far, and how's the program going?
As of yesterday, we've got about 16,700 and something that have been vaccinated, noting that for the Western Cape, our dose is about 13,000 every second week, which is we've received now parts of the second tranche. Hence, we have extended outside the metro, which is now the rural hospitals, and the staff from there, George, Worcester and Paarl, will be able to access. Plus also they are private, they'll be utilizing those hospitals. In the metro, we have expanded to Kalbrima, and also will be activating Mitchell's Plain. And also the Gatesville Melomed, the private, which will be able to accommodate the private health groups, because previously they were utilizing our health facilities for Saturday and Sunday. So we welcome that expansion. And already for phase 2 vaccination already there, because we envisage that we'll be vaccinating almost 3 to 4 million. But what is crucial, Ayesha, is about sequencing for equitable access. Because you get a lot of people where they say that I am a healthcare worker, where can I vaccinate? And then we say no, wait for your turn, because the issue of the individual vulnerability in terms of your age, in regard to having comorbidities, in regard to patient facing, and also criticality, whether you are working in the COVID ward, those are the people that need to be prioritized, especially under the circumstances where we've got a limited availability of these vaccines. Similar even in the phase 2, whilst it's the essential workers, it's all those who have comorbidities, the elderly persons, those in a high level of overcrowded places and all of those. We still have to, again, sequence. Because what is the use of targeting, say, you vaccinate all the teachers, and then you still have going to have a situation where the health system will be affected, because if those OMAs and those OPAs don't get vaccinated, they will still come and fill our spaces. So why would you jump to those who are still healthy?
Now, MEC, there's been this controversy about some doctors trying to get their family members to be vaccinated and getting them to pose as healthcare workers. I know that the Western Cape Health Authorities and you were at the DigiCon saying that there will be an investigation.
Yes, I also read it. Also, it happened in Gauteng. And also, there were some of those that I mentioned locally. We are busy with the investigations about those. But they also remember some of them, some, it's not necessary that they are not healthcare workers. There are those also who are healthcare workers, but they don't fit the criteria in terms of the vaccination because of the sequencing. Like if you are a nurse or a doctor working for the NGO where you don't even face patients, or some of them, it might be like here in Tygerberg now, there might be a healthcare worker who's working in psychiatry, vis-a-vis the one who works in the EC. So you have to prioritize the one who's working in the EC or in the COVID ward compared to the other ones. So that's why we appeal to the people that they need to wait for their turn. Just like as we, all of us, I'm also a healthcare worker, I'm a health professional, but I'm not facing patients. I don't have comorbidities. Therefore, we need to wait for our turn so that at least by the time that we have received all our doses from the 500,000 from the J&J for the implementation study, at least 40% of our health workers are vaccinated.
Thank you so much for your time. And that was the Health MEC for the Western Cape, Dr. Noma French-Mbombo.
Thank you very much, Ayesha, there outside the Tygerberg Hospital. Let's go now to Pietermaritzburg at Gray's Hospital, where Mawande Keswa is also standing by this morning as we continue our focus on reflecting on the year that was since the very first case of the new coronavirus was detected and confirmed in our country. Good morning.